All right, everyone, welcome back. Ready to dive into another juicy topic? Today we're wading into the world of IVDE and physiotherapy.
Yeah, we're tackling a question that I know a lot of us have been pondering, especially when it comes to those really tough IVDE cases where dogs have lost deep pain perception. Does physiotherapy actually make a difference in their recovery?
That's what we're here to find out.
Yeah.
And we've got this recent paper from the journal Animals to help us unpack this very question.
Right.
So this study piqued my interest, to say the least. Laid on me, what exactly do they do?
So they did a retrospective study. They looked at 51 dogs,
Okay.
all diagnosed with thoracolumbar IVDE, and all these dogs had undergone surgery. And here's the kicker. They all had lost deep pain perception.
Okay, so we're already dealing with a challenging subset of patients here.
Exactly. So they took these 51 dogs and divided them into two groups after surgery.
Okay.
30 of the dogs received physiotherapy.
Okay.
Called that the physiotherapy group, or PG.
Makes sense.
And then the other 21 dogs, they didn't receive any physiotherapy after surgery. That was the control group, or CG.
Classic study design. So walk me through this physiotherapy protocol. What do they actually do with these dogs?
So they used a standardized protocol, which is great because it allows for better comparison and hopefully replication. And they started this physiotherapy regimen right after surgery. It included a variety of techniques.
Like what?
Well, initially they focused on reducing inflammation, think like cryotherapy, cold therapy.
Mm-hmm.
Then they moved on to things like massage, kneading massage specifically,
Okay.
passive range of motion exercises to make sure everything kept moving.
Right.
And then they also used, now this one might ring a bell, neuromuscular electrical stimulation.
NMES. It's like a little jolt to try and wake up those muscles and nerves, right?
Precisely. It's applying those electrical currents to try and get those nerve connections firing again and hopefully stimulate some functional recovery.
Like a jump start for the nervous system. I like it.
Exactly. And then as the dogs in the PG group progressed, some of them even graduated to underwater treadmills,
Oh, fancy.
assisted walking exercises, things like that. So it was a pretty comprehensive program. They really tried to cover all the bases.
Sounds pretty intense.
Yeah.
Did they mention how long this whole physiotherapy regimen lasted?
They did. They kept it up until the dogs achieved what the researchers defined as a functional gait, basically meaning they could walk with minimal support,
Cool.
or for a maximum of 12 weeks after surgery, whichever came first.
So they gave those dogs a solid effort, that's for sure. What about the control group? What was their post-op care routine like?
So the control group, they still got standard post-op care, pain management, of course, bladder management.
Of course, got to keep them comfy.
Exactly, all the essentials. It's just they didn't get that extra structured physiotherapy.
Right, so everyone was well taken care of. But the key difference here was that hands-on rehab. Now, I'm curious, how did they actually measure the progress of these dogs? What kind of assessments did they use?
Well, they used a variety of standardized assessments to keep things objective. Primarily, they focused on evaluating each dog's ability to walk.
Okay.
Looking at their gait, could they ambulate independently? To assess that, they used the modified Frankel score.
Ah, classic. For those who might not be familiar, remind us what the modified Frankel score tells us.
Right, so it's a 6th-grade scoring system ranging from 0, meaning no voluntary movement at all, to a score of 5, which signifies a normal gait.
So they had a clear, standardized way to measure actual functional improvement, not just subjective observations.
Exactly, they weren't just eyeballing it. And they also made sure to document the neurological status of all the dogs throughout the study.
Because even subtle changes in a dog's neurological function can have a huge impact on their overall recovery.
Absolutely. So they were looking for any positive neurological changes, along with improvements in mobility, that ability to walk.
Makes sense. So with all this meticulous monitoring and data collection, what did they find? Did all that dedicated physiotherapy actually translate into better outcomes for the dogs in the PG group? I have to admit, I was really rooting for those dogs in the physiotherapy group.
Me too. Especially picturing those underwater treadmills.
Exactly. You'd think all that effort would equal some pretty clear benefits, right?
Right. You'd think so. But, well, this is where things get interesting.
Oh.
Yeah, when they analyzed all the data, they found no statistically significant difference in functional recovery between the two groups.
Wait, hold on. So you're telling me all that physiotherapy, and it didn't actually make a difference?
That's what this particular study suggests, yeah. The dogs who got the physiotherapy didn't regain their ability to walk any better than the dogs who didn't.
Okay, that's a little surprising, to be honest. But you said statistically significant. What does that actually mean in this context?
Good point. It means that even though there might have been some differences in recovery between those two groups, those differences could have just been due to random chance, not necessarily because of the physiotherapy itself.
Oh, okay.
Researchers use all those fancy statistical analyses to figure out if their results are strong enough to rule out that whole randomness factor.
Right.
And in this case, in this particular study, they weren't strong enough.
So it's not that physiotherapy definitely doesn't work for these dogs, but this study didn't really find the evidence to definitively say that it does.
Nailed it. And it's really important to remember this study, they were specifically looking at dogs with a loss of deep pain perception, which, as we know, is a much more severe form of IVDE.
Right.
So these findings, they might not apply to every single dog with IVDE, just this specific subgroup.
Okay, that makes sense. Now, I do want to circle back to this whole spinal walking thing you mentioned earlier, because that's fascinating.
Right. Isn't that wild?
It's like something out of science fiction. So the study did touch on this a bit, right? Tell me more. What is spinal walking?
So basically, spinal walking is when a dog can move its legs, even walk, but they don't actually have any feeling or conscious control over those limbs.
So they're walking, but they can't feel their legs. How is that even possible?
That's the million-dollar question. It really makes you wonder, right? It suggests that the spinal cord itself, even without any input from the brain, might be capable of more independent movement than we initially thought.
Wow. Like a backup system almost.
Exactly, like a hidden superpower. This whole spinal walking phenomenon, it kind of throws a wrench in our traditional understanding of how the spinal cord recovers after an injury. And it opens up so many new questions.
So did they find any difference in spinal walking between the physiotherapy group and the control group?
That's the thing, they didn't. A small percentage of dogs in both groups, the physiotherapy group and the control group, ended up exhibiting spinal walking. It wasn't clear from this study whether physiotherapy had any impact on whether a dog developed spinal walking or not.
Wow. So it really is this wild card in the whole IVDE recovery process.
Yeah.
And we're still trying to figure out what it all means.
Exactly. I mean, this study, it really highlights how much more we have to learn. It opens up more doors than it closes, which is exciting.
Absolutely. Now, I do want to touch on any limitations the researchers mentioned about their own study, because every study has limitations, right?
Of course, yeah. They pointed out a few key things.
Like what?
Well, for one, because it was a retrospective study, it's always a little trickier to control for every single variable that could be influencing those results,
They can't go back in time and randomly assign dogs to one group or the other.
Exactly. And they did mention that some owners chose not to do the physiotherapy for reasons totally unrelated to their dog's condition, like maybe the clinic was too far away or finances were a concern.
Right.
So that could definitely introduce some bias into the results.
It's not just the physiotherapy, but all these other external factors that could be contributing to the differences they saw or didn't see.
Exactly. And they also acknowledged that their sample size, while decent for this type of study, it could have been bigger. A larger sample size usually means stronger results.
More data is always better, yeah.
Always. But I get it. Finding 51 dogs who meet those specific criteria, it's not easy.
Not at all. And it's important to note that this study, they only look at one very specific physiotherapy protocol. There are so many different ways to approach physiotherapy and rehabilitation out there.
So many options.
So these findings, they might not apply across the board to all those other techniques.
Right. It's true.
Okay, so we've got this fascinating research paper, some head-scratching findings, and a whole lot more questions about this whole spinal walking thing. Where do we go from here? So where do we go from here? This research has really got me thinking differently about physiotherapy for IVDE cases, especially these severe ones.
It definitely challenges some assumptions, that's for sure. Makes you take a second look.
Absolutely.
Yeah.
It's clear that we can't just have a one-size-fits-all approach and expect it to work for every dog.
Right. We have to ask more specific questions, dig a little deeper.
Exactly. Like, are there certain subgroups of dogs with IVDE who might respond better to physiotherapy than others?
Right.
I mean, would a younger dog respond differently compared to, say, a senior dog?
It's a good question. We don't know.
What about breed-specific differences?
Yeah.
There's so many factors to consider. It also makes me wonder about the timing of physiotherapy. Should we be starting it even earlier, maybe?
That's an interesting thought. Could be. Or maybe certain physiotherapy techniques are just more effective than others for these types of cases.
Right.
Instead of a general protocol, perhaps we need to tailor the approach a little bit more,
Okay, yeah.
really personalize it based on that individual dog's needs and their specific neurological deficits.
Now we're talking. It's like opening up a whole new world of possibilities for research and treatment.
And you know what else is out there? All those other promising therapies for IVDE that we hear about.
Oh, you mean like photobiomodulation?
Yes, exactly.
Pulsed electromagnetic field therapy, electroacupuncture, all that good stuff.
Exactly. All those non-invasive approaches, they could hold a lot of promise, especially as we learn more about how they actually work, how to use them most effectively.
I'm ready to dive into those right now.
All right. It's fascinating.
It's an exciting time to be in veterinary neurology, for sure.
It really is. Each study, every new discovery, it's all bringing us closer to really understanding the complexities of the spinal cord.
And hopefully improving the lives of our patients.
Of course, that's the ultimate goal, right?
Absolutely. Well said. So for everyone listening, keep those brains buzzing, those hands learning, and never stop exploring those new frontiers of veterinary medicine.
Couldn't agree more.
And on that note, we're wrapping up another deep dive. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.